Hello everyone, welcome to Move Well, Live Well. We get a number of people that are coming here with issues regarding their SI joint, sacroiliac joint, pain in there, and pain in the tailbone. And these are folks, again, let's face it, we sit way too much and we're sitting down on that spot. And these are also folks who have started an exercise program. They've gone hiking, it's springtime, people are going out and about and they're hiking again, and they're going out and about. And now they've got this tailbone pain, SI joint pain that won't go away. They've seen their chiro, they've seen their physio, they're getting adjusted by even their osteopath, their DO, and nothing to no avail. In this video, I'm going to show you how to take care of that SI joint pain and tailbone pain. And it's a secret that a lot of people don't know about. So join me, shall you? Here's a little known secret that sometimes is often overlooked because sometimes, let's face it, these practitioners, sometimes they're in a hurry and they just go ahead and adjust you and then send you on your way. But the quadratus lumborum muscle is on fire. And that's what's going on with these folks. And man, it is no fun. Refers pain into that SI joint region, that tailbone region. Also even pain into the hip, kind of the side hip area, into the butt, and obviously in the low back. So what you do is you get your handy dandy lacrosse ball. This is it. Sometimes the solutions to our problems are very, very simple. And you just get yourself a good old handy dandy lacrosse ball. We usually recommend a lacrosse ball simply because it's very, very durable, very, very portable, and it's unforgiving. You see that? It's very, very good. Unlike, for instance, a tennis ball works well too, but unfortunately the tennis ball sometimes it can smush too much. So the deep fibers of the quadratus lumborum sometimes are a little bit missed if the ball is too squishy. So lacrosse ball is fantastic for that. If you want to kill two birds with one stone, you get yourself one of these peanut things. It's Skills is the brand, SKLS. I'll put a link in the description for these where to get them. Or you can just get a couple of these and tape these together, and then you're good to go. You don't need to buy one of these. Just get two of these and tape them together. Buddy tape them. So the reason for this one, you got a little space, between, so your spinous processes don't hurt. You can get in here and get both sides at the same time. So quadratus lumborum, it's a muscle that spans from your last rib to the iliac crest of your pelvis right there, and it allows for lateral flexion like this. So you're hiking, you're walking around, you're doing that stuff, trunk twisting, and that's what gets it mad. So get yourself one of these, and what you do is you just get here on the floor, just like this, simple solution. Get here on the floor, you put this sucker right there, just to the outside part. You can palpate your spinous processes here, that bony protuberances in your low back. And just to the side of that, you can get right into those muscles right there. And you just hang out on that spot. You want to search for these guys. You see that ball right there. See that orange? I'm just lying down right on that. And you can kind of roll onto it. You don't have to sit there and put all your weight on there. You can kind of lean to the side a little bit, just like this. And then slowly apply, as you can tolerate, you slowly apply your whole weight on it like this. That feels pretty good. And if you want more weight, you just lift up just like that. You go into like a little figure four. This is my right side, this is my right thigh and leg, kind of doing a little figure four here. And I can really feel that, and through there, that's pretty awesome. Ooh, you can feel that kind of going into the tailbone, the SI joint pain. It even feels like it goes into the hip right here. Sometimes glute medius pain. People think that's the rotator muscles of the hip, like the glute medius and stuff, and it's coming from the QL. See? Secret. And unfortunately, sometimes practitioners, your chiro, your physio, they may be in a hurry, or even your doctor of osteopathy, they're in a hurry, and you just come in, they rack and crack you, and They don't pay attention to what's going on in here. And this is what's going on. That QL is mad because of the new activities that you may be partaking in or just prolonged postures. Again, like I said, we sit way too much. So hang out in here 3 to 5 minutes, find a spot. Right there, I find a good spot. I can feel a little bit of referral. And nice, good, deep breathing. And man, that feels really, really good. Let that muscle melt into the ball. And then find another spot. All right, feel another spot right there. Again, melt into it. Just like that, 30 seconds to a minute or so. Work in here 3 to 5 minutes or so, at minimum. There's really no time limit on how long to do this. Again, do this to your tolerance. This could be very, very sensitive in here. And the idea behind this, good old lacrosse ball, imagine my fingers are muscle tissue, and as they bend over the lacrosse ball, you see, let's say the muscle tissue of my fingers, and you see how they bend over the lacrosse ball, it puts a stretch onto that lacrosse ball, and then that muscle can elongate and relax. SI joint pain, tailbone pain, hip pain, that won't go away. You're seeing your therapist and they're cranking away at your SI joint and all that stuff. And they're adjusting your low back. This is all you need. If you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who are battling that SI joint pain, tailbone pain, even pain going into the kind of the hip area. And it's not going away. They've seen their chiro, their physio, and they've getting adjusted by even their DO, their doctor of osteopathy. Share this with them. Sharing is caring. This is sometimes often overlooked. You go in to see these folks, and they go in there and they adjust you, and everything's, seems to be moving okay, but it's not going away. Share this with them. Sharing is caring because it may be the QL that's giving them a problem. Also, give us a thumbs up, give us a like, it lets us know you care. Thanks for watching, we appreciate it. We'll see you next time. Take care. Bye-bye.